it's an especially interesting time to learn how to handle all of life's ups and downs without food. And there are ways to do that feel fine. You know what I mean? Like it's not that we just take away food and be like, you have to suffer. I mean, there's really understanding how to handle feelings, notice them, what they are, sometimes why they're there, and then also realizing there's other ways to comfort yourself. It's really beautiful because you start to trust yourself in a different way. And I love how that sets up for parenting in a way that's so different than what many of us had.
Welcome to Baby or Bust. I'm your host, Dr. Lora, Shahine, and I am tired of infertility and miscarriage being misunderstood and full of stigma. Welcome to the podcast with interviews and in-depth discussions on topics all things fertility. Today, we're speaking with Dr. Stephanie Fein, all about weight loss for fertility. This is a controversial, complicated, and vulnerable topic for many, but I think you will appreciate Dr. Fein's approach to body image, evidence, and supporting the whole person towards their health goals. Thank you to our friends at Seattle Sperm Bank and Greg Moga for sponsoring the show. Take a moment to give us a 5-star review anywhere you listen to your podcast. It really helps people find the show. Weight loss and fertility is a hot button topic. While there are certainly more health complications at both extremes of weight, underweight and overweight, certainly obesity and reproduction can be a gray area of medicine. Too many times, BMI, or body mass index, which is a simple calculation of height and weight, is used as the single measurement to test and look for outcomes related to obesity for research. But reproductive health is more than a number on a scale. Too many patients leave a health visit feeling shamed and hopeless after a discussion about weight and fertility. I am excited to have Dr. Fein on the show today. She is an internal medicine physician who has taken her own journey towards motherhood and weight loss and turned it into a program to help others meet their weight loss and family building goals. Welcome to the show, Dr. Fein. It is so good to have you.
I am thrilled to be here. I love Baby or Bust.
Oh,
it's one of my faves, that I've got to follow. It's so good.
Oh, well, we have worked together for a long time. I refer a lot of patients to you, and I often refer them to your podcast, Weight Loss for Fertility.
Yeah.
Weight loss is such a vulnerable topic. People often have not had the greatest interaction with medical doctors like you and me when we're talking about weight. And so the fact that they can listen to your podcast before they reach out to you, I always think it's really, really helpful. So I'm so glad you're doing what you're doing.
Oh, thank you. I love doing it. And I agree with you. It's a nice way to hear some of the concepts and how different it is. And I hope that it feels safe, because that is something that I think really, I agree with you. It can be really vulnerable. And so it's nice to have someone who really feels like on your side.
Oh, absolutely. So tell us, I might call you Stephanie.
Please do.
Okay.
Oh my goodness. Please do.
You are a medical doctor.
Yes.
You worked really hard for that degree. So
I did.
Tell me a little bit about how you went from studying social psychology to getting a medical degree to practicing internal medicine. And now you're coaching people on weight loss and fertility. You have quite an interesting journey.
Oh, yeah. So fun. So the reason to me why social psychology in college is so interesting is because I purposely took it to not take any science classes.
That's funny.
Ta-da! Right. So anyone who ever goes to college, I'm like, oh yeah, don't worry about it. There's lots of stuff that can happen afterwards. So then I was aimless and I didn't know what I wanted to do. And I saw my friends being in medical school. And really, the real truth of it, and this is so interesting, is I hated the feeling of not knowing what I wanted to do. And my friends knew what they were doing for 8 more years, 7 more years, whatever. And I'm like, yes, please. Mm-hmm. So I had to actually take my sciences again. I went to medical school and then I did that little path. Mm-hmm. I ended up in internal medicine, which I really loved. I love like being able to interact with people, know them. It felt the most like, Dr. Welby, or you know what I mean? Like with being at home and part of them. But I didn't love how the office visit was set up. How you have to see them really quickly, short time, expecting basically medicines as the fix. And that just isn't the way I do it. I know it matters how you're sleeping or what your relationships are like or how stressed you are, all that sort of stuff. And I just was yelled at all the time for taking too much time with my patients. So I then decided that I wanted to change that. And so I actually got my master's in public health, and I was working in research, in health services research. And I worked on disclosure of medical mistakes.
Mm.
And I loved that also. And to me, it actually shows how I think about here. I know how difficult that is.
Mm-hmm.
So shame and perfectionism and all that I've always been interested in. And I was looking at it with doctors. After I left that, I do a lot of that work now. So in working with people trying to lose weight, and I am one of them, by the way, so I've lost 50 pounds and kept it off. I know the feelings involved there. And that's a lot of the work that I do, is helping people emerge from that, because our culture really does a number on us in terms of diet culture. So I was moonlighting in residency in a weight loss clinic. And when I was having these issues with, I don't like to be internal medicine and I started noticing how much I loved spending so much time with the people who were working on this. And so that's how I got into that more and more. I worked with different populations. And then I went to an obesity medicine conference that showed the relationship between higher BMIs and fertility. And my mind was blown. I just really didn't realize that it was connected. And very soon after, I started working with a reproductive endocrinologist actually to help her lose postpartum weight. And it just sort of clicked. The other piece of this is that I always feel very connected to new moms, like people in this exact place of building their family. My son came at 24 weeks, and I really get rough starts to motherhood. It's really something that is part of me. And so this sort of combines everything. And so I love, love, love working with people in this time. During pregnancy too, I can help them. And of course, after pregnancy, but the fertility work, trying to conceive, is really the place that I love working with women.
Oh, that is amazing. And I do want to go into some of the research, because I think that being overweight and underweight can affect fertility, can affect pregnancy outcomes, delivery risks, things like that. But just people feel so overwhelmed with just this message over and over. They got to lose weight. They got to lose weight. And I've seen myself, people are fertile at different weights, and people just get so frustrated with the very flippant, oh, just lose weight. And then your cycles will start being regular, or, just lose weight and your PCOS will go away, or just, or even shaming someone into thinking that the miscarriage is solely due to the fact that they're a number on a scale. I mean, it's just, some people come to me feeling so broken, but I do want to talk a little bit about the research, and I'd love to know, just a couple of details. Like, people talk about BMI, body mass index, and it's almost always the only point in the research paper. Tell me about BMI and tell me what the research shows about fertility and weight a little bit.
So it is, right. This is our medical system. And there's so many good things about our medical system, and there are so many things that are fraught. And the things to me that are nuanced, this is a beautiful example of it. So just for the information, the research out there, it's a U shape when we're talking about infertility on the y-axis and BMI on the x-axis. So what you're looking at is for underweight, which is anything under 19, so 18 in terms of the BMI, there are higher risks of infertility. And then there's a U shape, so it goes down, and the place is between 20 and 25 in terms of BMI. That is the lowest part of that curve. So there's the lowest connection between BMI and fertility there. And then it goes back up for the higher BMI numbers.
And just to clarify for everyone, like, BMI is body mass index, and it's a calculation of your height and weight that takes into account such a little part of overall health.
Yes. And I think the original BMI it's a study marker, and it's not even, it's a number, right? And so when we have a number, we're so happy to use it to do research. And I think that's really the only reason. That's why I would use something else if I could, but the research points to this. Like, we don't have to use the numbers, but I use them in the back of my mind as something like, okay, maybe there's something to this, but it doesn't have to mean that you as one individual has to be there. Because remember, this is lots of people. This is a research that's then produced a graph. We are not a graph.
And you're talking about the two extremes in weight, like
Correct.
Underweight can have impact on your reproductive health. Overweight can have impact on your reproductive health. So is there a BMI that people should shoot for?
So yeah, I will tell you a number, but I always hesitate to say it exactly that way because it depends on the person, right?
I totally agree.
Yeah.
Yes. That we agree on this, but I want people who've been told you have to have a BMI between, 24 and 28 in order to get pregnant. I want them to know where that theory comes from and like that it's not for everyone.
Right. Because remember, it's that graph. So wherever you are, if you're a BMI of 40 and you move to 35, you've improved the chances, right? So the literature says anywhere from 20 to 28. You have different studies showing 25. You have some showing below 30. So that's that piece. That's the answer to that question. Like in the literature, what you're looking at that.
What does the research show about obesity, specifically in women and fertility?
So it does look like it takes longer to conceive. There are higher rates of miscarriage and decreased rates with IVF. So it looks like that is something that happens, and it is in the literature if you look for it.
And I mean, there's always exceptions to the rule. Like there's always people that are going to be above a certain BMI and don't have any trouble getting pregnant and have never had a miscarriage in their life. But it is pretty consistent that the research does show longer time to pregnancy, higher risk of miscarriage, lower success rates with any fertility treatment. But in your understanding and research, do you know why?
They think, and at least this part we know, is that it has to do with insulin and inflammation. So insulin has a lot of effects on the body, and we have increased insulin when there is obesity. Again, which comes first, the chicken or the egg? We're not entirely sure, but the insulin resistance happens. There's more insulin on board, and it affects all our organs, our liver, the ovaries. There is an increase in testosterone production and a decrease in some proteins that the liver makes. And therefore you have an imbalance in the sex hormones. And it's such a delicate balance, as you well know, that when something is off, it really can make a difference. So insulin first, and then adipose tissue itself is pro-inflammatory. That's where we get a lot of the inflammation, but also it can produce estrogen. And so again, you're affecting the balance of the sex hormones. Yeah. Now, the thing with the pro-inflammatory part of the adipose tissue, which is fat, adipose tissue is fat, is that the visceral fat is the one that affects, the inflammation affects the organs more. And that's the first fat usually to be lost, which is so fantastic. And I think that is where we get, because this is exciting news, that it takes only 5 to 10% of weight loss in order to make a significant difference in both the insulin and the inflammation. So they showed that difference with fertility.
So I just want to clarify that because that's new to me. And I think that is really exciting. I want to make sure that the listeners get that. So when you think about weight loss, you might just sort of think about you yourself getting on your scale in the morning and looking at this number. But you're describing that there's different types of fat. There's fat like out in the body, and then there's visceral fat. Visceral fat is like all in the organs. You can't see it, on your body. It's, within your intestines and kind of all inside. And what you're saying is it's the visceral fat that makes the most disruption in our hormonal system.
Yes.
And that a positive thing is that when you are trying to lose weight, it's the first one to go.
Yes.
So that is really revolutionary because you could, in a very positive way, talk to a patient about trying to optimize health, not trying to drastically lose a ton of weight, but start making changes that are positive. And even a little bit is going to really help their hormonal system.
Yes.
I love that.
It's so fantastic. So if someone's 200 pounds, 10 pounds makes a huge difference. Yeah, it is so fantastic. Now, sometimes it's really hard to lose 10 pounds.
Oh, yeah.
But 10 pounds is still something that's more doable than someone saying you have to lose 50 pounds, which is often what they'll say if you're going from a BMI of 30 to 25.
Right. Because you're just looking at this one number that is just, it's so limiting. But that goes along with what I often talk to my PCOS patients about. So polycystic ovarian syndrome, super common hormonal disorder that can be really associated with ovulatory dysfunction, inflammation, insulin resistance. And a lot of studies do show that losing 5 to 10% of the body weight can all of a sudden people can start ovulating on their own and having regular, predictable menstrual cycles. And I've had patients who say, I know when I go up 10 pounds, I never know when my period's going to come and I go down 10 pounds. Like it's not everyone.
Right.
I think that's pretty fascinating. I think about weight as kind of like a lot of things, like a two-hit issue, there's some people who, have a tendency towards something, say like lung cancer, but it's only if they smoke that they'll actually get it.
Right.
There's some people that might have a tendency towards PCOS or irregular ovulation or infertility, and the obesity really pushes them over the edge to that. But then there's people who are obese that don't have PCOS and don't have fertility issues. Do you think, this is how I just do it in my little brain. Do you think, does that make sense to you?
Oh, yeah. Oh, that 100%. That's exactly. And I have worked for so many years with people. So I have seen all the different kinds. There are some people who can lose weight. Like one of the concepts that I work with, and they're done, like they just lose it, done. It's easy. Other people who really have tried everything and it's just a slower process physiologically, right? I don't know why. I don't know why. And of course, for those people who it's physiologically more difficult for, they've had so much sort of really diet trauma is what I call it, because they don't know what's normal. I have seen everything. So when I'm working with someone, I'm like, oh, this is fine. This is normal. And just by the way, not even talking about someone with like a more difficult issue, but regular weight loss is a 0.5 to 1 pound a week.
Mm-hmm.
It's not more than that.
Yeah.
It's not 5 pounds in a week.
It's so hard though, because, patients who are struggling with the desire to start their family right now or yesterday or years ago, and they might be, fighting against fertility and age. Like they might be close to 40 and they kind of know egg quality is decreasing. And it's really hard to find that balance between weight loss and time.
Yes. This is why I love the 5%. Because so 10 pounds can be done in, 3 months. That's like a significant change, a significant physiologic change can happen in 3 months.
And that's more attainable than just sort of saying like, go lose 100 pounds or something like that.
Exactly.
Yeah.
And of course, depending on how you do it, right? Because you can lose that weight by not eating anything or having only shakes or this sort of thing. But I care most about sustainability. And so if you do it in a way that's sustainable, then that 10 pounds is gone.
Yeah.
And you're continuing through, because you can lose weight in the first trimester.
Yeah.
You could actually, depending on your situation and your goals, and you can lose weight through the entire thing.
Yeah.
And of course, that decreases some risks also. So, there is a way. This is why I'm here on the planet, is because not only can you lose weight, but you can feel good doing it. You can feel better about yourself. You can have a better relationship with food. And that is, priceless.
Well, I really do want to talk about what you do, because I'm always looking for support for my patients. I'm a doctor. I can do IUIs, I can do testing, I can do IVF, but my patients need help with mental health. They need help with sometimes physical therapy, sometimes yoga, so many things. And when my patients want to lose weight, or we think that's going to be beneficial for their health and their reproductive health, before you, I really only had kind of clinics to send them to, and they'd often come back and just say the only thing they had to offer was bypass.
Yeah.
Or, they'll find somebody on Instagram that's sort of like a fitness guru that isn't really thinking about their hormones or they're trying to conceive, I don't want my patients to have a beach body.
Right.
I want them to feel good and to meet their goals and not crash diet or
Yes.
exercise, because that has harmful effects. So
exactly.
what do you do? What's your program like? How does it work?
As I said, because it's just so important. My main purpose is to change the relationship with food and to have it be a sustainable thing. So once the weight's off, it's off. Not only that my clients have tools to know exactly what to do to eat whatever they're going to eat for the rest of their life, on vacation, on, for anything. Now, the other thing too, of course, is you're getting pregnant and then you're having a baby. Lots of stuff is going on. That life looks it's all really hard. And if we don't have the right tools about how to think about food, then that stress can lead to more weight, because the only way we gain weight is overeating. And overeating is defined as anything more than your body needs. Okay. And there's 4 reasons for overeating: over hunger, over desire, habits, and then emotional eating.
Mm-hmm.
So in terms of over hunger, if you don't have a good relationship with your body in terms of when it asks you for food, you give it. And then when it's had enough, you stop, which is actually not very easy to do if you've never thought about it that way. And we haven't, if we're in diet culture, which says, starve yourself,
Mm-hmm.
Eat 3 calories and
Mm-hmm.
you should be fine with that.
Mm-hmm.
And so getting back into listening to our body is a really important thing. Over desire can happen with processed foods. So sugar and flour act in our brains truly like heroin and cocaine and all that sort of thing. Like, it is a processed white substance.
It's a dopamine hit.
It's a
cocaine to your
concentrated
brain.
one. It really is.
Yeah.
It's a concentrated dopamine hit that you want more. So your brain's like, ooh, that was good. Let's have more.
And it feels good.
It does.
You feel good for a little bit when you eat. You
and
really
you
do.
want it again.
Mm-hmm.
You want it again, and you want it again. And that's the brain is doing that. So there's that piece. There's also the emotional eating piece, of course. There's a coping mechanism we've developed, and it has served us. Like you just said, it does feel good, but for a moment. And we absolutely need to. I always think of it as often as kids or younger people, we didn't have a lot of, if no one taught us how to deal with our feelings, which, I don't know who, not so many people have that, but also you didn't have a lot of agency, right? All you could get was food. It's not, you weren't going to drive away when you're 8. So it makes sense why a lot of us use that, but it no longer serves us when we've bumped up against something that we want to change. So having different ways of handling emotions and then getting comfort, because of course we still all need comfort, and it's just that we don't necessarily need it with food.
Well, what I like about your program is you don't tell my patients to limit calories. You don't tell them to completely cut out carbs. You don't give them a meal plan that's like, okay, you're going to eat, granola with Greek yogurt in the morning and a tuna fish sandwich. And a salmon. Can you tell I have done diets before? And I myself have really struggled with a relationship with food, and growing up in the 1990s with Kate Moss and the heroin chic look of models, and never having that body. And I feel for my patients that are in the middle of one of the most stressful issues of desiring a family, already feeling betrayed by their body because they're not getting pregnant. And then also at the same time, feeling shame because maybe their body being overweight really is a part of this. And what I really like about what you do, and I've worked on this a lot myself too, is realizing that there is no quick fix, that you can't exercise off calories.
Yeah.
And you have to do a lot of soul searching to figure out why that's a coping mechanism and find ways to really soothe yourself in different ways.
Yeah.
And so you do a lot of the mental work with people.
Definitely.
And I just really, like, when I asked you what your program was like, you already went into that, and I appreciate that. So I just want people to understand, like, this is not some blog post that you can read and get some recipes. Like, Stephanie is really working with you on a journey And I love that the way your program is set up. It's like we're working together and, until you're pregnant, and then we can continue. So it's a really delicate time in someone's life.
It really is. And in fact, the fact that they're going through cycles and results and all that sort of thing, it's a time when food could be used as comfort. So it's an especially interesting time to learn how to handle all of life's ups and downs without food. And there are ways to do that feel fine. You know what I mean? Like it's not that we just take away food and be like, you have to suffer. I mean, there's really understanding how to handle feelings, notice them, what they are, sometimes why they're there, and then also realizing there's other ways to comfort yourself. It's really beautiful because you start to trust yourself in a different way. And I love how that sets up for parenting in a way that's so different than what many of us had. Oh. So being connected that way is really beautiful, and that they can give that gift to their kid about the relationship with food.
Oh, look at you.
Yeah.
That's amazing. It's going above and beyond
exciting.
And thinking like long-term. I really, because most diets are like, okay, you want to lose 10 pounds, like here's the way to do it, but it's not sustainable.
Right.
This is like really a way of thinking, shifting. I have a question. What advice do you give to your clients, the people that you're working with, on how to talk to their providers about weight? Oh. I mean, how many patients have just been shamed, or the doctor is visibly uncomfortable talking about it? Do you have any tips for people on how to bring it up?
So this is the way I think about it. And it's hard because it's putting it on the person who shouldn't have to do it, right? Like
agree.
Right. So, but in order to get the most out of what you can get. So number one, be informed. And part of that would be listening to something like this, understanding that there is in fact research. And so to have it in your own mind about what you want. Have you decided that you do want to lose weight? Mm-hmm. And maybe you can then go in saying, I know the research and I understand that weight may be an issue. I'm asking for your help. Do you have any recommendations? Do you have any, that sort of idea? So being informed. The other thing too is if you decide you don't want to talk about it, then you say that.
Yes, I totally agree.
And you're allowed. Mm-hmm. Then it's up to the two of you. But that is an acceptable thing. You are allowed. You can direct your healthcare and you can say, I'm not interested in discussing that right now.
Yeah. That's great. And I have reached out to you as a provider to talk to you and coach me on how best to talk to patients. So for any providers out there, anybody in healthcare, doctors, nurses, anybody, what Stephanie taught me and what I do with patients is I bring it up in a non-confrontational way. And I sort of say, hey, I talk to my patients about a lot of different lifestyle optimizations to improve their fertility, prenatal vitamins, vitamin D, moving their body, managing stress. And a lot of patients do want to talk to me about weight. I realize that weight is a sensitive issue. Is it okay if we talk about it today? So I ask, and I was never taught that in medical school.
It's so beautiful. I like A+.
Oh my God. Well, sometimes people say, you know what? No, today's not a good day. I say, okay, cool. Yeah. Next time, let me know. And if they do want to talk about it, I just give information. But that you really helped me with that.
First of all, that's so beautiful because it is exactly what you just said. It is one of the many factors. So we talk about age, whether there's stigma there or not, it depends. Of course, it really depends on how the physician feels about it. And how it's presented. But the way that you did it to me is exactly it. It's a sort of matter of fact, like, this is all research-based. These are the 12 things I talked to you about. Weight is one of them.
Yeah. There was this one patient who I'll just never forget. I saw her 10 plus years ago. Oh, she's such a personality. You walk in the room and just glowing. She's so funny. She's so amazing. And her BMI is 65. I mean, that is a significant weight. Mm-hmm. And she had been to 3 IVF centers, multiple different doctors, done IVF elsewhere, all this stuff. And I didn't bring it up as politely as I just taught you because I am constantly learning. But I brought up her weight, mainly about being safe and doing procedures and limitations that we have And she said, I was the first doctor that ever talked to her about weight.
Mm.
And she's like, Dr. Shahine, it's like the elephant in the room. Like, I know it's an issue. I just never wanted to bring it up. And it was a really good discussion. She was a really special person.
Mm-hmm.
I have some questions from Instagram.
Yay!
I love it. I reached out to the community there and I let everybody know that we were going to be chatting today. And I found 3 questions. There was a theme. There was a theme in questions. So I've got 3 for you. So Trish and several people asked, does a history of gastric bypass impact fertility or pregnancy?
Yes, great question. So it would depend. Really, the answer is no, is the short answer. There are nutritional issues, but you should already be hooked in with someone who you're seeing annually afterwards to make sure to get the testing for the B vitamins. There's a couple of them that you have to just make sure that your levels are okay. That would be the same for whether you're trying to get pregnant or not. So that you would just continue that. If you gained weight and you're now in a different BMI than you had wanted to be, then it would be the same risks as anyone else who is in that BMI. So the answer is no, it's not a problem.
Okay. Sara asks, can someone use Ozempic or Wegovy for weight loss while trying to conceive? This is such a hot topic right now. I mean, it seems like every celebrity is on Ozempic and losing incredible amounts of weight. But can you tell us a little bit more about, how they work and what we know about using them while we're trying to conceive?
Yes. So Ozempic and Wegovy are the same medication. Ozempic is the one that was approved for diabetes. And what they found was that people were losing weight. So then they got it approved for weight loss also. So it's the same medication. It's a GLP agonist. And it works by delaying gastric emptying, which means that the food doesn't leave your stomach as fast as it normally would. It also has effects on your brain and the appetite regulation so that you're not as hungry. You're literally not as hungry.
Mm-hmm.
That's how it works. So,
okay.
I mean, just to be clear, you eat less food.
Yeah, that's how you're losing weight. Right.
That's
okay.
how it's not anything else magical. It's that you're eating less food.
Okay. And I know it's so new and there's so many people that have just started using it, but I just wonder, what happens when they stop using it?
Yes.
Because the reason you're losing weight is you're sort of tricking your body not to want to eat or to feel full. But then it's like when you stop, if you haven't changed your mindset or other habits in your life, like without it, isn't all the weight just going to come back? And I know we don't know the answer yet.
No, we do. We actually do know the answer.
Oh.
It does come back. Yeah, yeah.
Well, there you go.
No, the studies they did themselves. Yeah, I know. The studies that show the great weight loss over a year. Now, it is nice. They did a study for a whole year and it did show a lot of weight loss. But when they stopped it, that next year they gained it back.
All right.
So it's actually designed. I mean, right now it's marketed and the way that they say to prescribe it is forever. It's a forever medication.
Okay, that's important.
Yeah.
Okay, well, what if someone is trying to conceive and they've been told you have to get under a certain weight? Like, what about using it while you're trying to get pregnant?
Yeah, so this is the tricky part. It looks, in animal models, there is a higher miscarriage rate and fetal abnormalities, period. So it's contraindicated at time of conception, and they think before that too. So the recommendation at this point is you have to be off it for 2 months before you can do egg retrieval, transfer, conceive, anything. It has to be off. Now, this is sort of interesting. In 2027, they're going to have data on pregnancy because there have been women who were on it and got pregnant.
Amazing.
So
okay.
they rolled them into studies. And so in 2027, we'll have a little more information. But as of now, we know that animal models have this problem.
Yeah. And it is really new. I mean, it is definitely better to be safe than sorry when it comes to medication.
I think so.
I know.
Yes.
Okay. Samantha asks, is it safe to try to lose weight while you're trying to conceive? How do you balance nutrition needs, but also with weight loss?
Amazing. So what that question tells me is a very normal way of thinking about dieting, which is restrict, restrict, restrict. That is not the only way to lose weight, thank goodness. And so the answer is absolutely you can lose weight while you're trying to conceive, but not in a way that's unhealthy. And many diets are, because they're asking you to restrict and use willpower and take away food groups and all that sort of thing. But if we're doing the hunger scale, which is something I use, I love this, which is you eat when you're hungry and you stop when you're satisfied, then you can eat anything. Literally any food, the carbs, the sugar, you can literally eat anything you want, but you're listening to your body. In this way, you absolutely can do it. And what a lot of us do is we wait until we're very hungry, and then we're so hungry that we overeat, and then we feel out of control. But so if we're learning how to eat when we're hungry, stop when we're satisfied, you can eat anything. You can absolutely, and you can lose weight and I mentioned it before, while you're pregnant.
Yeah.
If you're doing it in this way that every time you're hungry, you're eating. So we're never not eating when we're hungry.
Yeah. I see so many people just being so frustrated by feeling out of control, by not having their family when they're ready, feeling like their body is, not working for them, but working against them. And they get into this really restrictive cycle. Like, oh, I saw on Instagram that gluten is inflammatory, so I'm going to cut out all gluten. And then they don't get pregnant that cycle. And they're like, oh, I must have not been good enough, in air quotes. I got to, now I got to restrict all dairy.
Yeah.
And it becomes a cycle of restriction and being punitive.
Yes.
And you're more about really learning your body's signals and really shifting an entire mindset. It's really like life coaching, more than just weight loss for fertility.
Yeah. It's about the relationship with yourself, because what you just said it perfectly about being punitive never works. It just never, we think it does. We get convinced that it does. It doesn't. And so then when we're changing our relationship to no longer beating ourselves up, it feels so much better. It just feels so much better.
Oh, exactly. Oh my gosh. I have loved having you on the show, Stephanie. I could just talk to you all day. How can we find you?
I am at stephaniefeinmd.com for my website, and then at Stephanie Fein MD on Instagram. And you can DM me, you can reach out. There's also Weight Loss for Fertility podcast, where you can get a lot of, and I'm just about at a year. So there's
Awesome.
a lot of episodes that people can get started and listen to and have a place to start.
Fantastic. Thank you again, Stephanie. I really appreciate you coming on the show.
My pleasure.
I hope you enjoyed today's discussion with Dr. Fein as much as I did. I loved learning from her approach to weight and fertility, nutrition, and meeting goals. Find this episode and all others on my website, drlorashahine.com. You can find more education and information on my YouTube channel, Instagram, TikTok. Please send us an email to hello@drlorashahine.com to let us know topics you'd like us to cover, share your own fertility story, and let us know if there's people you'd like us to interview. Thank you to my producer, Shannon Perry, and her team at Audiotocracy. This is your host, Dr. Lora Shahine. See you next week. And until then, wishing you love, luck, and pineapples.